My name is Peter McPherson. I'm president of the Association of Public and Land Grant Universities. And with me are two people from the University of Kentucky, Eli Capilouto, who is president of University of Kentucky, and his new vice president for land grant engagement, and also the dean of agriculture, food, and development. We're pleased to have the opportunity to hear about all the excellent things happening at Kentucky. I've had the pleasure of being on your campus, and I know what great work you do. But Eli, you have just created this new position for Nancy to do, I'm sure, good additional work here, the Vice President for Land Grant Engagement. Can you tell us a little bit why you did this and what is the vision behind this? And maybe Nancy will expand upon that as well.
The University of Kentucky was birthmarked with service as part of its mission over 155 years ago. And it's been manifest day after day after day during those 155 years. We're one of the few universities that birthed an academic medical center, a land grant that birthed an academic medical center. That was a little over 50 years ago. And if you look at that first curriculum at our medical school, they had a course on how you treat a community. Physicians are typically taught how to treat patients one at a time, but I think it was that notion of service and community that's been a part of our fabric from the beginning that manifests itself there. I think during a time of some great uncertainty, it was important in our decision-making that we have a voice and perspective like Nancy's at the table. We're in all 120 counties, for instance, with our extension service. And that was important. And I thought it was a great signal to those outside of, especially our urban areas, although this applies to our urban areas as much as rural areas, where there could be some heightened uncertainty, is that your priority and serving you is a priority for the university of, for, and with Kentucky.
This new position of Vice President for Land Grant Engagement is new to me. I've been in it for a few weeks, but it reflects Dr. Capilouto's commitment to Kentucky. It reflects the strength of extension in Kentucky. We are fortunate to be one of the states with a fairly large extension program and a lot of investment with counties or from counties. And so we like to say we're hardwired into each county, 120 of them, and high touch. And so we have the people in place. And we have begun collaborations with other colleges, and this appointment to the vice presidency has really kick-started even more collaborations.
Yeah, this role beyond the College of Agriculture for the rest of the campus, I gather that's a key part of what you want to do here, Eli and Nancy?
So as I mentioned, we had already begun collaborations with such entities as UK Healthcare, the Nursing College, the Barnstable Brown Diabetes Center, and others. And we are trying to expand these partnerships in a community-centered way. We have just revitalized and re-envisioned our extension system, and we did a statewide needs assessment with over 30,000 responses and several hundred focus groups. And we have 3 top priorities for each county, or for the counties collectively. 1 is substance use and mental health. 2 is economic and workforce development. 3 is community leadership, engagement, and pride. Certainly the number 1, substance use and mental health, will require a lot of partners. Although we do have a faculty member in Extension recently hired who works in mental health and substance abuse, Dr. Capilouto, you will remember Alex Ellswick. And so we are venturing out with programs, but we need partners and we need to make a difference.
The partners that you'll have, they'll be community partners, or will they also be link back into the health center and other places on campus?
All of those things. We'll have community partners that we already have a lot of community partners. We have our extension system in Kentucky has 250,000 volunteers that help us engage with our programs. And so we're hoping even to expand those. But definitely many of the colleges at UK have an outreach function, even the Kentucky Geological Survey, who will help us monitor environmental quality in counties. So it's a broad range of partnerships. Healthcare is going to be very important. And we envision ourselves as oftentimes we will be convening the meetings and bring the partners in, and they will interact with the community. But we will broker those meetings in each county. And the Kentucky counties are not very populous. Only 7 counties in Kentucky have over 100,000 population, and the remainder of the 120 are in the average of 20,000 or so. So we are often the most hospitable and nicest facility to convene a meeting. We have the relationships in the communities, and we're hoping to parlay that into a comfortable spot for other colleges to have representatives.
Now, often in a state, people aren't quite sure where to go in the land-grant university or the big university to have a particular problem addressed. And they think of extension, incorrectly so at this point in things, as being dominantly agriculture and natural resources. I know extension is substantially more than that, and important ag and important other things. But do you envision this being a place, your office is a place that people will see as around the state, a place they ought to go to if they've got a set of water issues or land issues or a whole range of other things? Is this kind of the first stop?
Absolutely, we would like to think of it as the first stop or the one-stop shop and the way to get answers. And then we're doing that pretty well now with our network, but we hope to have even a larger suite of programs to offer. And we are working in one of the counties with the poorest water quality in the state, Martin County, and we have brought environmental experts and physical activity experts and nutritionists to come and work with that county. So we hope to have that even more hardwired in as we go forward.
And Peter, I would add, what I also envision here is heightened collaboration across our university. We're one of the 4 states that received one of the NIH Healing Community Grants. And for us, it's an $87 million grant.
Wow.
Where we had put forth a proposal to reduce deaths from opioid misuse by 40% in 3 years. We do that in partnership with community. It's a community-based intervention in many ways, but we see other opportunities for which we can leverage our talent to meet some of those issues that Nancy has identified in the survey of some over 30,000 people. And as you noted, Peter, a lot of times people have one notion of the focus of extension, and you can see through those surveys that those sort of departed from what you said many people would think of first.
The trick, I think, often is to have that one-stop office or first stop be able to have the rest of the university pull together to solve the problem. So you've got the medical center. Of course, I know, Eli, of your special interest and capacity in the whole medical area, but throughout the university, I mean, that always gets a little tricky in practice. Is that a fair way to think about this, Eli and Nancy?
I think so. We are a big place, complex, complicated. I'm glad to say we have many front doors.
Yes, yes.
And they go beyond our campus. So the more that we have Nancy at the table when I'm working on those issues that crosswalk across our medical center and many of the other disciplines and fields we represent, her knowledge of community through extension especially, I think, heightens our ability to make certain people get to the right doors and that we're responsive.
Good. Now, of course, you've got another land grant university there in the state, Kentucky State. I know, Nancy, you've done some work with them as well.
We consider Kentucky State a very close partner. We have 16 county offices that are cohabitated by agents from Kentucky State
Really? I
and
didn't know
UK.
that. Good for
Yeah.
you. Good for you.
And we also have a lot of partnerships in our biggest urban area, Jefferson County. And we just received a NIFA grant to offer programs to low-income youth in that county, and we'll all be working on that. We're just down the road from each other, which helps a lot. We have a lot of adjunct professors in various departments that go back and forth, and we're working together on our Distilled Spirits Institute and other collaborations right now involving agronomic horticultural crops.
What are some of the issues that Kentucky is involved in communities or major questions at this juncture? You mentioned the opioid problem, which is that's a huge grant, and congratulations for the impact it's having. You want to talk about some others?
We're working a lot to empower communities to produce food for themselves. One of the outcomes of COVID has been an intense interest in local gardening and food production. So we've worked a lot with counties before COVID and since COVID. We have some programs in the Louisville area or Jefferson County where we do gardens with a very large refugee population that is in Louisville. And so we're trying to consciously give more to that county because they really are only large urban setting in Kentucky.
It'd be interesting to see whether or not the family food production will continue post-COVID, won't it? It is kind of a return to the earth movement actually at the moment.
Yes, nobody could find tomato cages this summer in the whole state. But
right?
yeah, but we've partnered with the First Lady of Kentucky and other entities on some of these kind of self-sufficiency issues. We also have done a lot of financial counseling since COVID.
Really?
This summer with our family and consumer science agents. They have a specialty in financial counseling.
Well, there was certainly some need for that. Maybe to close off this really great opportunity to talk to the two of you, Eli, I know you continue to be deeply committed to access and degree completion. Maybe a comment or two about that. You and I, we've had some great stories together, or I've had some great stories from you over the years. You want to comment a moment about all that?
I will, and I have to, before I say anything, commend an incredible faculty staff who have doubled down on their commitment to student success. So this year, our first year retention of students, I think, made it to 86.7%, nearly
Good for you.
85%. That's a 5%, absolute 5%, 5 percentage points, I'll say,
Right.
increase in the last 4 years. To see that, especially in the face of COVID this year, that we continued our ascent, and relative to other universities in the state, we've done well. And we're on a performance funding model, so it matters. But I'm particularly pleased of the movement we have seen in first generation, low income, and underrepresented students. Those have been some of our best gains. We have much more work to do, but it's taken a lot of visible and invisible hands to reach those numbers.
Well, congratulations for the work on some of these populations that around the country have been particularly impacted in their college attendance and otherwise. And this is so important, the work you're doing. In fact, I'm intrigued but not surprised to see the continued figures of the importance economically and so many other ways of four-year degrees. So the success that you're having in terms of access, and I know that's completion, and that 5% X or retention is going to turn into numbers for sure, graduation numbers. But thank you both. It's a real pleasure to be able to talk to you.